Lexi Popovich, and we are here to kind of discuss some vaping impacts with youth and young adults, and also how to educate yourself as a parent and a teacher. Okay, so just a little bit of background education. These are some of our emerging trends that we see in the community, that we see with schools and youth. A lot of the flavors and bright colors, things that are sleek in design that are kind of geared towards youth. You can see in the upper right, those are actually marijuana cartridges. So those are also being found in a lot of the schools that we work with. And we'll get kind of more into that. But just as this is kind of like the new emerging trends that e-cigarette companies are marketing to youth at really young ages. So there's been a few generations of e-cigarettes that have come up, but the ones most recently have been Juul, and then with some one-time use or disposable products. So that's some of the hides and puff bars, they're called. And there was a flavor ban in New York State that outlawed flavors. So then a loophole was having one-time use or disposable products where you could kind of use those flavors. So they've become really popular in the schools. And particularly with youth, they were kind of targeted towards youth because of nicotine salts. So nicotine salts, basically, it's almost like an effective menthol. It makes it less harsh to inhale some of these products. So if you're a first-time user or really young adolescent, it's actually easier for you to inhale, and you'll get more nicotine to your brain faster. And that creates a lot of risk and impact for nicotine addiction at a young age. So this is something that we see and deal with in the community. But that's kind of a little bit of background about why these products have been so popular. So again, I mentioned the flavor ban and why these disposable and one-time use products are so popular amongst youth. Kids want flavors, they want candy flavors. There's over 8,000 flavors on the market. And again, with the nicotine salts, say you have a 12-year-old using nicotine for the first time once or twice, they can become addicted that quickly. Some others won't, but it all really depends. But the younger you start, the more addicted you can become. And we also like to educate on tobacco marketing at the point of sale. So basically the point of sale is, you can see in the far right corner, is when an individual goes to a convenience store or corner store and actually purchases a tobacco product. So this is the area where there's a lot of promotions and advertising, and this is geared directly towards youth and young adults. Some of the products will be next to candy, other kind of sodas and kid-friendly products that kids would naturally go to. They're going to be at their kind of eye level. If you're a young kid and you go to a corner store, those products are going to be advertised around those areas. And also Big Tobacco will come in and send consultants in to corner stores, and they actually offer incentives to owners to put some of their products at certain locations that are more accessible to youth, or around certain areas with the chips and soda. So that's actually something the local stores will make money off of. And again, Big Tobacco is doing that to make their products more visible, make it seem like these products are acceptable and normalized amongst the youth. And that actually increases use amongst young adults, because the more they see, the more they think it's normalized. And people that are quitting or trying to quit actually makes it harder for them to quit. So different impacts, and Ryan will get into this a little bit more, but some impacts for nicotine use and what that means for addiction for young adults. You have kids already going through puberty and a lot of mental health stressors that are happening, with mental health being a big thing, and also post-COVID. So then you add in, the use of nicotine and withdrawing, and we hear that a lot of students are trying to quit, but these are so addictive that, causes things such as cognitive impairment and brain development problems. Again, not only on the lungs, but your body and your brain. If you're that young, you're starting at, we see 10-year-olds starting and using these products, and you're kind of creating, addiction for the other substances down the road, and different parts of the brain that aren't as developed. And then you add in students who are trying to quit. You're going to see impairments in learning and behaviorally in the classroom, in and out of the classroom as well. So teens who use tobacco or nicotine are actually 4 times more likely to drink alcohol, 8 times more likely to use marijuana, and 22 times more likely to use cocaine. This is, again, from the different brain patterns. So when you're getting nicotine, it binds onto your receptors in your brain, that actually creates different neurotransmitters that also are found when someone's using these other substances. So your dopamine and other parts of your brain are going to light up. So it kind of sets that tone and sets those neuropathways early, that so if someone was to try another product, they'd actually be more likely to become addicted. And we also like to educate on marijuana. We see a lot of dual usage in some of the schools. This basically means if you're caught using nicotine product or vaping, most likely if they're caught with marijuana and some of these vaping cartridges, they're actually also using nicotine. So not the people that are caught with nicotine, but some of the youth that are using cartridges, the marijuana cartridges, are most likely always using nicotine vaping cartridges as well. And it's still legal for youth under 21, although New York State retailers will be coming to our area shortly. But again, illegal for anyone under 21 years of age. We know and work with a lot of schools who have youth that are taking these products and ending up in the hospital because the potency is so much higher in some of these than it used to be. Again, they're getting access to these, and we hear kids that are taking edibles, and on the package, if you have one gummy bear and it says, take an eighth of this, and kids are just, taking them, and then you have a really serious situation on your hands with young adults. And we like to educate on youth and sports. Usually if we're presenting to students, we like to ask, who's an athlete or what are their goals with being an athlete, and a lot of them are actually vaping. So just how that impact on the body, brain, and lungs and different development, and how that kind of affects their performance, and if they want to continue playing sports and go into college for that. So a lot of times they're inhaling these products, and with your lungs it's vasoconstrictive, so that can affect your heart and how much blood is pumping to your body. So again, your performance can be affected. Nicotine addiction during games. I can't imagine being back in high school trying to play a sport or practice and knowing I needed to go use my product. We have heard, I had a friend of mine whose friends were lacrosse players, and they couldn't go through the whole game, so they'd put chew in between their toes, and that way they could get the nicotine into their body without vaping or whatnot during the game. And again, this is a slide mainly for youth, but also parents on the cost of these products. And if you have a student or a child who's using one Hyde product or 2 Hyde products a week, it kind of we estimated how much you would be spending. If you're using Juul, like 1 pod a day for 7 years, from 14 to 21 years old, that's about $6,300, and that's just kind of average of how many pods or different products people are using a week. And so I think as a parent, if you're getting children money and for the kid themselves, I'm seeing just not only the health impact, but also the economic impact. And so overall, as a parent, as a teacher, when you're talking to your child, you really understand the impacts of these products. You guys are here tonight learning about vaping, but doing research, and there's a lot more research out there and accessible fact sheets that you can start learning more what these products look like and understanding nicotine withdrawal and addiction, and how to kind of speak to a child or young adolescent about this, or also prevention. If you have a really young child, starting talking early and understanding how to work with teachers when there's a situation when you have a youth, and everyone kind of being on the same page of what's going on. Also for youth, understanding they can talk to a school counselor or a teacher and be aware of different cessation resources that are available. And actually, if your youth is under 18, you can go to their pediatrician with them, and you can actually get prescribed nicotine replacement therapy and actually offer it to them to use. So that is something that is here in New York State. So if that's something that you talk to your pediatrician with your child about, that can help provide those cessation resources if they're having trouble quitting. And this is a list of some of the more recent youth cessation. So it's basically youth-based, different cessation programs and quit lines. There's some that are text-friendly, that they'll get texts every day to help them quit. And there's different programs that some schools have implemented that kind of, if you're caught using a product, instead of out of school suspension and being punitive, where they're going to go home and vape probably the whole time, taking a course and learning about the effects and working with the school counselors on if they want help with quitting. And I'm going to pass it over to Ryan.
So I just wanted to highlight from our perspective, the Center for Tobacco-Free Finger Licks, a lot of times the target audience for my presentations is typically the health systems themselves. I work a lot closely with the doctors within different health systems and doctors' offices to make sure that they're up to date with the best practices for smoking cessation, how to have those conversations, and making sure that that's something that they're doing with all of their patients. But a lot of that information can really be tailored to this conversation, because we talk about vaping in schools or smoking cigarettes in schools or using tobacco in general at all. And most students think of those damages or those dangers being punitive, as opposed to thinking of them in terms of the lifelong impacts to their health that could occur. So that's what I really wanted to highlight with this section of the conversation tonight. A lot of the harms of tobacco use, it's so important to understand how there is no safe form of nicotine. There is no safe form of tobacco use. We know that 60% of lifelong cigarette users will die prematurely from smoking. We also know that smoking causes 1 in 5 deaths in the United States right now. It is also a major contributing factor to poverty, and of course poverty we know also affects health outcomes. So it will have an impact on your health in terms of your ability to seek care and to have access to care. And then of course we know that vaping and smoking damages adolescent brains and leads to addiction, as we've kind of covered already. I really like being able to present some of this information, because when we talk about the chemicals that are in cigarette smoke or chemicals that are in tobacco smoke, we know that there are thousands and thousands of dangerous chemicals. And a lot of times when we hear those chemicals, if I say that there's formaldehyde or if I say that there's acetone or arsenic, we hear those chemicals, and for most people you might know what that is, but you don't necessarily know why you need to know what that is. But if I tell you, in other terms, that formaldehyde is embalming fluid and you're breathing that in with every cigarette. If I tell you that arsenic is the main ingredient in rat poison and you're breathing that in with every cigarette, or that there is tar or lead or butane, all of these different chemicals you see here, plus thousands more, suddenly that becomes more impactful. That's an impactful conversation. And that's why it's important to make that conversation a connection, so that you can understand exactly what those dangers are. Again, we know that there's thousands of chemicals, but we also know that there are hundreds of those chemicals which are also known carcinogens, meaning we know that they cause cancer. And the same rings true for chemicals in e-cigarettes. We see that those carcinogens do still exist, sometimes even in heavier quantities or in a larger amount than traditional cigarettes. Those toxins that we know of, propylene glycol, benzene, heavy metals. In fact, U of R research, which is where the Center for Tobacco-Free Finger Licks exists, U of R research directly was one of the contributing factors to finding copper as one of those heavy metals. So talking about some of those e-cigarettes and the fact that it is not just water vapor. You almost always hear somebody who's using a vape say that it's just water vapor. And we know that that is entirely untrue, that it does contain nicotine and many of those chemicals. We know that e-cigarettes, that vapor actually penetrates much deeper into the lungs than traditional cigarette smoke. So those ultra-fine particles actually reach places that even cigarette smoke doesn't reach, those very, very minuscule pockets inside of your lungs, which is bringing those chemicals deeper and closer to a more damaging area of the lung. We know that the flavorings in e-cigarettes contain chemicals, a lot of them also similar to food additives in order to create that flavor, but some of those chemicals are irreversibly harmful to the lungs. You may remember a little while ago there was kind of a bit of a vape epidemic, and it was very much in the news, people getting very sick from vape. And that was because of the volatile organic compounds that we see in vapors, such as the vitamin E acetate that you can see there. And then again, those heavy metals, nickel, tin, copper, and lead. Lexi touched upon very quickly a little bit of the spit tobacco. I can tell you that in my previous career, I was the health educator for Wayne County Department of Public Health for over a decade, and I did a lot of work with the schools, and that was actually a very common thing that we heard was students who would actually use spit tobacco, and then in order to keep it a little bit secret, they would put it between their toes so that that nicotine could get absorbed into the bloodstream that way. That is something that as astonishing as it is to hear, is an actual occurrence. We know that spit tobacco actually can be extremely addictive compared to regular cigarettes, that it actually can contain 3 to 4 times more nicotine than smokable forms of tobacco, and that a typical spit tobacco user will have 8 to 10 chews per day, and that can equal about 30 to 40 cigarettes, so almost 2 packs a day worth of nicotine there. We also know that they contain thousands of chemicals, and again, many of them known carcinogens. And then the mixture of tobacco and nicotine and sweeteners for flavorings, but abrasives. I like to draw attention to that word because spit tobacco actually contains minute particles of fiberglass, which are intended to actually create micro cuts in the gum lining so that that nicotine gets absorbed through the mucous membranes in your mouth much quicker. It brings more nicotine into the blood system. It brings it in much quicker, so it's a much more effective and efficient delivery system. And then again, we also know, again, that they are and can be much more addictive than traditional cigarettes because of that higher level of nicotine. So touching back upon vape and smoke, a lot of people know about secondhand smoke. It's something that a lot of us have learned about for quite some time, but more and more research going into third-hand smoke and what that is. It's a little bit less known, although it's been around for a little bit now. That third-hand smoke, that passive smoke and vapor, essentially what that is that's any of that smell that lingers in a car or on somebody's clothes or inside their home. If you've ever driven down the road behind somebody who's vaping, you can sometimes smell it because of how intense that smell is. That smell in and of itself, when you recognize it and notice it, even when nobody is using a cigarette or a vape around you, is contributing to potential damage. That smell is in and of itself a harm. So we know also that propylene glycol and glycerol, which are specific to vapes, are especially hazardous to pets. This is something that actually gets overlooked a lot of times. We think about the second and third hand smoke effects on our family and friends, but we oftentimes forget about our four-legged fur babies and how that is also something that gets exposed to some of those chemicals. And specifically, again, 2 of those chemicals we know are toxic and hazardous to pets. So it is essential for me to stress, and we always stress, that there is no risk-free level of exposure to tobacco smoke, vapor, and that there is absolutely no safe form of a tobacco product whatsoever. And we kind of touched upon this a little bit already, but that nicotine addiction in youth, what exactly is happening there? We know that a lot of times, again, teens don't think about the dangers of nicotine itself. They think about the danger of the device in terms of how will I get in trouble for this, but we don't think about that lifelong impact. We actually know that nicotine is one of the most addictive substances that we know of. And nicotine harms that adolescent brain development, that very, very crucial time when a brain is developing, and that nicotine can actually hinder that. We do see that nicotine addiction can decrease learning ability. We see that it decreases attention spans, that it significantly lowers the ability of a student to not only have short-term and long-term memory impacts at the time, but also in the future. We see that it leads to behavioral problems, and again, that future addiction opens the door to addiction to many, many other substances, which we do see a connection of in terms of addictive substance use connected to somebody who is previously or an ongoing nicotine addiction candidate. So we talked about some of those carcinogens. I just like to point out all of the different cancers that we know are linked to tobacco use. In fact, tobacco use contributes up to 40% of all of the cancers that we diagnose across the United States each year. And most of them you've heard of: lung cancer, you've probably heard of throat cancer, mouth cancers, different things like those types of cancers. But some of the ones we don't think about, the stomach cancer, kidney, and even bladder cancers, we don't really think about those. But when you think about what your body is doing with those chemicals, that it is filtering those chemicals out of your blood in your kidneys, putting those chemicals into your urine, that urine sits in your bladder for hours, and before you get rid of it, those chemicals are sitting in those places for hours and hours and hours, and then repeating that process every time a cigarette is used. So we don't really think about how impactful and deeply penetrating those chemicals can reach different parts of our body. So I like to point out some of the resources that we talk about quite a bit. The Quit Line and the Quit site for New York State, they are programs that somebody who is under 18 can access. In fact, the Quit site itself also has a live chat and text to quit feature. The text to quit feature on the Quit site is the same text to quit program that Lexi discussed earlier. So it's just an additional avenue to that very wonderful and evidence-based resource. This is evidence-based cessation services. That means we can back up with data that it is an effective tool to quitting nicotine. So just a quick slide to show you what that Quit site looks like. It's very easy to navigate. It is very helpful. Again, there is a live chat talk now feature. There's a link that will give you information on the different nicotine replacement therapies. Sometimes we call them NRTs. That's going to be your patch, your gum, and your lozenge. So those are traditionally available over the counter without a prescription if you are 18 or older. But as Lexi touched upon earlier, pediatricians can and will oftentimes, if necessary, prescribe NRTs for a student who needs them in order to quit tobacco use. And then last but not least, that tools section in the lower right-hand corner is where you can access some of the text to quit features that we were talking about. And then of course we also have quit programs at the U of R. There is free cessation support. It's available in both English and Spanish. There is text messaging support, and it does include nicotine replacement therapy. All of those services are free. When I did cessation myself, and now that I teach people how to do cessation, I have always, my whole life, said there is no such thing as too many tools in your toolbox for something like this. You must access and really benefit from accessing that very large web of support for something like this, because it is a very difficult process. Once you start and once you've become addicted to that nicotine, it is extraordinarily difficult to quit, but it is so, so important that you do.